Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. We don't just want to address the tongue tie or the torticollis or the baby's difficulties in whatever it is that's going on. We want to address the concerns specific to breastfeeding. We want to make sure that even if there is a tongue tie, it's the tongue tie causing the concern. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Palladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Welcome back to the Tongue Tie Experts podcast, the podcast dedicated to helping perinatal, dental, and lactation professionals stay informed and connected. I'm your host, Lisa Palladino, and today we are discussing a crucial aspect of tongue tie management that often gets overlooked. Looking beyond the mouth, actually looking beyond the infant to the mom. Tongue tie or ankylosing is frequently discussed at conferences and in professional circles and all over social. And, we're hearing all about laser releases, and that can be amazing, right? But it's important to remember that if the person doing that release or somebody on their team has not given that mother-baby dyad a comprehensive evaluation and treatment for the mom, then we won't achieve optimal outcomes. I think we'd all agree that a successful outcome is so much more than a released frenum. A successful outcome for the breastfeeding baby is comfortable and efficient breastfeeding. So let's start with the 3 key areas of assessment that I look at as a lactation consultant, okay? We look at maternal, we look at infant, and we look at the feeding. So each of these assessments is critical in understanding and addressing the full scope of breastfeeding challenges related to tongue tie. If you are a pediatrician, a dentist, or any other release provider, or a body worker, or whoever is in my audience listening, as a professional who is interested in this topic, Your scope may not include maternal or breastfeeding assessment. You may be networking with other providers for this evaluation. But this discussion will help you to have insight into what lactation professionals are doing in their consults and hopefully have a deeper understanding of why collaboration is crucial. We have to think about maternal assessment first and foremost. And this involves, as any medical assessment, both subjective and objective evaluation. So subjective includes gathering a thorough history and understanding what the mother is experiencing. I ask about everything from, their age, their marital history, if they're in a relationship, their menstrual history, their gynecological history, their pregnancy history, their medical and surgical history, including any breast surgeries or breast health issues. It's also important to consider nutritional, emotional, and hormonal histories such as PCOS, thyroid disorders, diabetes, infertility, need for artificial reproductive technologies. All of these are important when we're assessing maternal health and ability to breastfeed. You want to inquire about any allergies or intolerances to food, medications, or supplements, and find out if she is taking any medications, any supplements, any galactagogues or suspected galactagogues. There's a lot of things that people think they're taking that are going to help their milk supply that don't always help their milk supply. Previous breastfeeding history is also vital, as well as any history of mental health issues such as depression, anxiety, substance abuse or use, or history of abuse. As a objective observer, you want to observe her general appearance. Is she pale? Is she looking nourished? Is she well groomed? Does she look like she's been sleeping? Is she breathing comfortably or appearing agitated or sleepy? We want to really assess her emotional status, her comfort, her milk supply, signs of sleep deprivation, anxiety, hypervigilance, depression. Understanding the emotional and physical state is crucial if you're going to provide comprehensive care. Then we want to go to the feeding assessment. Now, I'm not going to talk about infant assessment today. There are lots of episodes about infant assessment on the podcast, so you can go back and look at that. Everybody's always talking about frenum and assessing frenum, and I'll have more detailed podcasts coming up all about the different tools that we can use to assess the frenum and what I use to assess the frenum and the mouth. But today I want to talk about the symptoms of feeding, or what's going on in the feeding, right? And that has to do with much more than just weight gain, right? So the feeding assessment focuses on evaluating the infant's feeding behaviors. And that includes things such as, how is the infant being held? Is it in an optimal position for deep latch? Is it a good position for that particular baby? How does the infant latch? Is there any tugging, biting, clamping, or anything else that appears to cause nipple damage? Does the parent seem comfortable during the feeding? Are there obvious and regular swallows? Does the infant seem satisfied after a feeding? Are they sleepy, relaxed, tense, fussy, or crying? All of these things are things that we are observing. We want to see what's going on right after the feeding. Is there immediate reflux or spitting up? Does baby hold the feeding down? Do they seem comfortable after the feeding? Do the breasts feel full, or are they relieved after feeding? Is the feeding transferring milk? And how much milk is transferred during the feeding is important. And we often use before and after weights to determine this, but that's just a snapshot. A well-trained lactation consultant can see and hear and observe if they're sucking and swallowing and milk transfer during the feeding. Are you ready to elevate your skills in tongue-tie management and enhance your impact on new families? You're in the right place. Hi, I'm Lisa Palladino. I'm an RN, midwife, and lactation consultant with almost 35 years of experience. Our comprehensive course is designed specifically for perinatal, medical, dental, and birth professionals like you, providing you with the expertise needed to address the challenges of tongue ties and support successful infant feeding journeys. By joining our waitlist today, you'll gain exclusive access to early bird enrollment. You'll be the first to know when our doors open and enjoy special pricing available only to our waitlist members. You'll get expert insights, regular updates, and tips from me, ensuring you stay at the forefront of TOTS care. You'll get a thriving community, immediate access to a professional-only Facebook group where you can connect and grow with peers who are just as passionate as you are. Plus, a special gift. As a thank you for joining our waitlist, you'll receive our very popular free checklist, Preparing for the Day of Frenotomy. This invaluable resource is the guide I share with my own patients. It's packed with practical advice that you can start using today to improve your practice and patient outcomes. Sign up below. We also want to think about what is going on for that mother-baby dyad. What are the mother's goals for feeding? I would love for everybody to always exclusive breastfeed, never have to give a bottle. But that's me. I have to support what the parents want for this particular child. So we want to determine the goals, and then we want to see where they are and where they want to go. So say a mom wants to exclusively breastfeed, and right now she is feeding at the breast for 4 feedings and pumping and giving bottles for 6. So now you want to think about, how are we going to get her to the breast for those other feedings? And what can we do to make those feedings more efficient, more comfortable for her? So that's the type of assessment. You have to know what's going on before you can say what you can do to get her to her goal. Now, this doesn't, as you can see, I haven't mentioned tongue tie yet, right? Because there's so many other things that could be affecting this breastfeeding relationship other than tongue tie. I had a mom a couple of weeks ago who thought she had to keep giving bottles because the baby had jaundice in the beginning, and her pediatrician gave her misinformation saying that the baby needed to be supplemented with formula, even though she had plenty of copious breast milk. So, you want to really find out what they're doing and why, and carefully see what the reasons are before that, so that, the reasons are underneath what they're doing, so that you can guide them to where they want to be gently and, with much respect and care. You've heard me say this before, I'm sure, unless you're new to the podcast. I keep a box of tissues on my table that's right next to the couch where the families sit when they come for a visit, because I want to ask things that are going to allow the mother to tell me how she's doing, really how she's doing, right? So I want to know how she's feeling about the birth, what the birth was like for her, what things are, how things are going on now for her. Does she feel supported? I may be the first person who has asked her these things. So it's very, very important to get this enumerated, get this expressed. And it's often like a kind of therapy session, right? Okay. So we want to know about pumping. Are they over pumping? Are they under pumping? Does that hurt? We want to see how the feeding ends and what the nipple is like after a feeding, what the breasts are like after a feeding, right? And then we want to, very, 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 very crucial, to include emotional and psychological support assessment. So you want to know, where are they in this recovery period? Since 2020, I have had more reports of birth trauma and postpartum depression in the moms I see than ever before. It's really, really sad, and I feel awful when I hear these stories. Everybody is reporting birth trauma. Like 90% of the moms that walk through my office feel like their birth was traumatic in some way. So we have to take that into consideration and realize that, if you're a medical professional seeing a mom between birth and her 6-week checkup, you may be the only medical professional seeing that mom. So even if you're a pediatrician whose scope is not the mother, I think it would be your moral responsibility to do an assessment to see, is there depression going on, especially if she tells you that there's some concerns, or she appears, like she's not taking care of herself, or appears anxious or depressed. And if there's any signs there at all, and if she says she has no support, be very wary, that those are the moms that, feel alone. We want to make sure they're supported. So how do we do an assessment? There's a tool called the Edinburgh Postnatal Depression Scale, which is a very easy few questions. You can just hand it to the mom and know who you're going to refer to if you suspect postpartum depression. And, you want to be aware of the signs of normal baby blues versus more severe conditions. And that's beyond the scope of the Tongue Tie Experts podcast today. But it's important, if you take care of moms, for you to understand this. So you want to provide support through referrals to resources like in New York, we have the Postpartum Resource Center of New York. The Motherhood Center is a great resource. Just have some place in your local area that you can connect moms to. Even if you have a handout sheet, a handout of resources, and include these in there, that's a step in the right direction. Remember, you may be the only person that sees this mom between the birth and their 6-week checkup, unless there's a medical problem. So when we are trying to do something physical for mom, for baby, we have to realize that the postpartum period is a tremendous upheaval period, emotionally, psychologically, hormonally, and we don't value that scope of how tumultuous that could be. So anybody who's listening, who's a mom, understands this, right? You're tired, you're in pain, you may be bleeding, you may have nipple pain, you're trying to meet this little new one. Maybe you have other kids, you're trying to integrate this baby into your family. You may or may not have a supportive partner. Even if you have a supportive partner, there's not so much they can do, right? So you want to really, and when I say there's not so much they can do, I don't mean that they're not helpful. Let me say that again. If you have a partner who is supportive, they still can't be the ones that are going to breastfeed the baby. They're not the ones feeling the physical things, right? And honestly, if they went to sleep all night, baby'd be okay. But you have to be the one, in most cases, to take care of that baby. And we get all the joys on the other side of it too that dads don't get. I'm recording this. I forgot to tell you guys, I'm recording this on the 33rd anniversary of becoming a mom myself. My son was born 33 years ago today. And today I'm reminiscing a lot about what those early days were like. And it was a precious time. It was a hard time. I didn't have postpartum depression, but I did still have some challenges that, looking back on, weren't actually recognized. I definitely was expected to bounce back quicker than I really should have been expected to bounce back. And my son, we had some breastfeeding challenges. I didn't know anything about breastfeeding back then, and I was a nurse. But yeah, so today's a mom, 33 years today. So fun. Okay. So then the other thing we want to think about is, not only do we want to address the infant stuff, we don't just want to address the tongue tie or the torticollis or the baby's difficulties in whatever it is that's going on. We want to address the concerns specific to breastfeeding. We want to make sure that even if there is a tongue tie, it's the tongue tie causing the concern, right? So some of those concerns could be related to breasts or nipples, right? There could be nipple soreness, cracking, infection, over fullness of breasts, engorgement, mastitis, milk supply. And I keep brushing past milk supply. I have at least one other podcast that addresses milk supply, and I will have more on milk supply. There's so much to say about milk supply. I also have a course about milk supply for professionals, and you can get that link in the show notes of the podcast or on any of my social or tonguetieexperts.net. The link to the professional milk supply course is there. It's a lot of great things to know for if you're a professional who works with mothers in any way and you haven't learned lactation side of things. It's good to have some hints or understanding about milk supply if you're taking care of breastfeeding families. Okay, so the interesting thing about milk supply is that one of the highest mentioned reasons for stopping breastfeeding is perceived milk supply problems. So perceived low milk supply when there actually isn't diagnosed low milk supply. So that could come from lack of confidence. It could come from a otherwise well-meaning healthcare provider suggesting that there's not enough milk. It could come from a family not understanding how to tell that baby's getting enough. These are things that are important to learn if you, again, have a family in your care that breastfeeds. And one thing that I always like to say when I'm talking about maternal issues and low milk supply is that a very simple rule to remember is that if the infant needs any supplement at any time, the mother, especially if she wants to breastfeed and wants to continue breastfeeding, she should pump for every bottle the baby is given, right? So the first choice to supplement with is always mother's own milk. And the only way to get that is either hand expression or pumping. So if baby needs a supplement, we should also be trying to get the milk to feed the baby from that baby's mom, if possible. And it's not just about giving that bottle. It's about keeping that mother's breast stimulated, keeping the breast cells aware that they need to make milk, because it's that makes the milk keep coming. So if you don't remove milk, you don't make milk after a point, right? Some people make a lot of milk all the time, no matter what you do. But for most cases, if you're not emptying the breast periodically 8 to 12 times in 24 hours, the milk supply will not be sufficient for the baby. So that's really important. So if there's supplementing going on, we want to make sure that we are pumping or hand expressing and getting the baby back to breast as soon as possible, and making sure that there's a valid reason for that supplementation. And I saw some hearts there, so people are agreeing with me. So as we wrap up today, I want you to remember that successful management of tongue tie requires a holistic approach that considers both the mother and the infant. And by thoroughly assessing and addressing all aspects of breastfeeding, we can help ensure better outcomes for both. So thank you for joining us on this episode. And if you found it helpful, please subscribe and share it with your colleagues. Don't forget to check our show notes for more resources and information. Until next time, keep supporting and empowering the breastfeeding families you work with. Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Palladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.